The exercise effect. Evidence is mounting for the benefits of exercise, yet psychologists don't often use exercise as part of their treatment arsenal. Here's more research on why they should by Kirsten Weir. And this is put out December 2011, volume 42, number 11, page 48. Exercise is something that psychologists have been very slow to attend to, says Michael Otto, PhD, a professor of psychology at Boston University. People know that exercise helps physical outcomes. There is much less awareness of mental health outcomes and much less ability to translate this awareness into exercise action. Mood enhancement. If you've ever gone for a run after a stressful day, chances are you felt better afterward. The link between exercise and mood is pretty strong. Otto says, usually within 5 minutes after moderate exercise, you get a mood enhancement effect. Research shows that exercise can also help alleviate long-term depression. There's a good data to suggest that active people are less depressed than inactive people. And people who were active and stopped tend to be more depressed than those who maintain or initiate an exercise program, says James Blumenthal, PhD, a clinical psychologist at Duke University. The evidence comes from experimental studies as well. Blumenthal has explored the mood-exercise connection through controlled trials. In one study, he assigned sedentary adults with major depressive disorder to one of 4 groups: supervised exercise, home-based exercise, antidepressant therapy, or a placebo pill. After 4 months of treatment, Blumenthal found patients in the exercise and antidepressant groups had higher rates of remission than did patients on the placebo. Exercise, he concluded, was generally comparable to antidepressants for patients with major depressive disorder. Blumenthal followed up with the patients 1 year later. Subjects who reported regular exercise at the 1 year follow-up had lower depression scores than did their less active counterparts. Exercise seems not only important for treating depression, but also in preventing relapse, he says. In 2006, Otto and colleagues reviewed 11 studies investigating the effects of exercise on mental health. They determined that exercise could be a powerful intervention for clinical depression. Based on those findings, they concluded clinicians should consider adding exercise to the treatment plans for their depressed patients. Anxiety. Researchers have also explored exercise as a tool for treating and perhaps preventing anxiety. When we're spooked or threatened, our nervous systems jump into action, setting off a cascade of reactions such as sweating, dizziness, and a racing heart. People with heightened sensitivity to anxiety respond to those sensations with fear. They're also more likely to develop panic disorder down the road, says Jasper Smits, PhD. Smits and Otto reasoned that regular workouts might help people prone to anxiety become less likely to panic when they experience these fight or flight sensations. After all, the body produces many of the same physical reactions: heavy perspiration, increased heart rate in response to exercise. They tested their theory among 60 volunteers with heightened sensitivity to anxiety. Subjects who participated in a 2-week exercise program showed significant improvements in anxiety sensitivity compared with a control group. Exercise in many ways is like exposure treatment, says Smits. People learn to associate the symptoms with safety instead of danger. In another study, Smits and his colleagues asked volunteers with varying levels of anxiety sensitivity to undergo a carbon dioxide challenge test in which they breathed CO2-enriched air. The test often triggers the same symptoms one might experience during a panic attack: increased heart and respiratory rates, dry mouth, and dizziness. Unsurprisingly, people with high anxiety sensitivity were more likely to panic in response to the test. But Smits discovered that people with high anxiety sensitivity, who also reported high exercise levels, were less likely to panic than subjects who exercised infrequently. The findings suggest that physical exercise could help to ward off panic attacks. Activity may be especially important for people at risk of developing anxiety disorder, he says. Questions remain about which type of exercise is most helpful. Most studies have focused on aerobic exercise, though some research suggests weight training might also be effective, Smith says. Then there's the realm of mind-body exercises like yoga, which have been practiced for centuries, but have yet to be thoroughly studied. There's potential there, but it's too early to get excited, he says. Next section, buffering the brain. It's also unclear exactly how moving your muscles can have such a significant effect on mental health. Biochemically, there are many things that can impact mood. There are so many good open questions about which contribute the most to changes in depression, says De Groot. Some researchers suspect exercise alleviates chronic depression by increasing serotonin, the neurotransmitter targeted by antidepressants, or brain-derived neurotropic factor, which supports the growth of neurons. Another theory suggests exercise helps by normalizing sleep, which is known to have protective effects on the brain. There are psychological explanations too. Exercise may boost a depressed person's outlook by helping him or her return to meaningful activity and providing a sense of accomplishment. Then there's the fact that a person's responsiveness to stress is moderated by activity. Exercise may be a way of biologically toughening up the brain so stress has less of a central impact, Otto says. It's likely that multiple factors are at play. Exercise has such a broad effect that my guess is that there are going to be multiple mechanisms at multiple levels, Smith says. So far, little work has been done to unravel these mechanisms. Michael Lehman, PhD, a research fellow at the National Institute of Mental Health, is taking a stab at the problem by studying mice, animals that, like humans, are vulnerable to social stress. Getting the payoff. Of all the questions that remain to be answered, perhaps the most perplexing is this: if exercise makes us feel so good, why is it so hard to do it? According to the Centers for Disease Control and Prevention, in 2008, the most recent year for which data are available, some 25% of the U.S. population reported zero leisure time physical activity. Starting out too hard in a new exercise program may be one of the reasons people disdain physical activity. When people exercise above their respiratory threshold, that is above the point when it gets hard to talk, they postpone exercise's immediate mood boost by about 30 minutes, Otto says. For novices, that delay could turn them off of the treadmill for good. Given that, he recommends that workout neophytes start slowly with a moderate exercise plan. Otto also blames an emphasis on the physical effects of exercise for our national apathy to activity. Physicians frequently tell patients to work out, to lose weight, lower cholesterol, or prevent diabetes. Unfortunately, it takes months before any physical results of your hard work at the gym are apparent. Attending to the outcomes of fitness is a recipe for failure, he says. The exercise mood boost, on the other hand, offers near instant gratification. Therapists would do well to encourage their patients to tune into their mental state after exercise, Otto says, especially when they're feeling down. Many people skip the workout at the very time it has the greatest payoff. That prevents you from noticing just how much better you feel when you exercise, he says. Failing to exercise when you feel bad is like explicitly not taking an aspirin when your head hurts. That's the time you get the payoff. It may take a longer course of exercise to alleviate mood disorders such as anxiety or depression, Smith adds. But the immediate effects are tangible, and psychologists are in a unique position to help people get moving. We're experts in behavior change, he says. We can help people become motivated to exercise. And that's it.